global leadership in medical intervention and innovation. What specific diseases do you believe deserve less medical research?
DEI.
Okay,
We've got $1 billion.
Do you have a specific program, a specific disease that deserves less funding?
I would say we're putting $1 billion into DEI, and DEI research has never cured any disease. It's never.
Welcome back to Freedom Forge. If you care about truth, accountability, and cutting through political noise, make sure you hit that like button and subscribe right now, because what we're about to break down today is something the mainstream media is not going to fully unpack for you. Today, we're reacting to a Senate hearing focused on the Department of Health and Human Services budget, where lawmakers are questioning proposed cuts to medical research, healthcare access, food assistance programs, and rural health funding. At the center of it all is a tense exchange over priorities, what gets funded, what gets cut, and who ultimately pays the price. And let me tell you right off the bat, this hearing is a perfect example of what happens when ideology collides with reality.
As the gentlelady from Arizona, Ms. Grijalva.
Thank you for your time today. I have to say, as I listen here, with all the health initiatives that you're espousing, I have grave concerns about the HHS bill budget and the cuts that are being proposed. I spent 20 years on a school board and saw firsthand how support systems children have or don't have outside of the classroom shape their outcomes. At the most basic level, children can't go to school if they're sick, they can't learn on an empty stomach, and their families can't get ahead if they can't access health care. I'd like to first talk to you about your proposed cuts to medical research. I was reading an article this morning that talked about your affinity to perform your own medical research. You apparently once cut the penis off a road-killed raccoon to study them later. You speak fondly of medical research, yet your budget cuts show that the National Institutes of Health are going to get a cut of more than 12%. This level of cuts would halt promising research, force layoffs of scientists and research staff, and undermine America's global leadership in medical intervention and innovation. What specific diseases do you believe deserve less medical research?
DEI.
Okay,
we've got $1 billion.
Do you have a specific program, a specific disease that deserves less funding?
I would say we're putting $1 billion into DEI, and DEI research has never cured any disease. It's never produced any new drug.
Okay, so between February of 2025 and April of 2025, HHS canceled or froze more than $180 million in National Cancer Institute grants. Were you the one to approve these cuts to cancer grants, or did that come directly from the White House?
We're giving the highest, one of the highest budget increases to NCI.
Can you just answer my specific question? Were you the one who approved those cuts, or did that come from the White House?
As I said, we are raising the budget for NCI, for the National Cancer Institute, in this budget. It's one of the only agencies throughout my, sub-agencies throughout my entire agency that's receiving a raise.
Okay, so Secretary Kennedy, you have the responsibility to tell the truth to this committee, and here are some examples of cuts. In April of 2025, HHS canceled an NIH grant regarding strategies to reduce cancer and chronic disease in the Arkansas Delta. In 2025, a grant selective targeting of pancreatic cancer was cut. In March of 2025, a grant, the automated digital imaging for cervical cancer screening. The list continues to go on. You've also noted that SNAP can be used to purchase whole foods. And when we look at some of the recent data, just in Arizona, the district that I represent, 424 fewer people, including 180 children, have lost food assistance since the enactment of H.R. 1. My constituents are writing to me telling me that they're hungry and cannot afford food. As the Secretary of Health and Human Services, will you make a statement here today that you oppose hunger in this country?
Well, I oppose hunger in this country, and we're the first administration to be doing something about getting actually good food.
Well, thank you. I'm grateful that you're standing against the Republican hunger cuts. And if HHS spends $21 billion on physician training, yet only 1% goes to community-based programs like teaching health centers that actually reduce primary care shortages, why are we underinvesting in the models that work?
For rural health?
For community health centers.
I just put $143 million into community health centers for physician retention. We also put $50 billion into the Rural Transformation Process program, which has a lot of money for
Yeah.
rural healthcare frontline physicians, to retain them, to keep them, to do residencies there. It's unprecedented.
So just so you know, only 1% of the funding that you've talked about actually goes to teaching health centers and community health centers. And health centers lower costs and improve
But
outcomes
you asked
for
about the
Medicare
problem.
patients. Yeah.
We're trying to solve the problem of rural residencies and rural access to rural personnel, and we're doing more than any administration in history to do
So
that.
unfortunately, there are 5 rural health centers in Arizona that are at risk of closure because of cuts from this administration. So what are you doing to ensure that every Medicaid patient can access a community health center?
There's 39 million Americans in community health centers, and my personal belief is that it's the most effective health centers in our country.
Absolutely.
What they're doing is better than any, and we're making big investments to make sure that they continue. We've raised the funding in this budget for community health centers, and then I'm finding other pockets of money to funnel, as I did last week, $135 million.
I would really like to see the data that shows that, because the rural health communities and health centers in my district are suffering greatly under this administration.
Well, I announced the
Thank you,
program.
and I yield back.
I announced the
Thank you.
program in Arizona last week at a
General Lady.
community health center.
So let's break this down. You have a lawmaker coming in, clearly concerned about healthcare access, especially for children and low-income families. She makes a point that, honestly, nobody should disagree with. Kids can't learn if they're sick, they can't function if they're hungry, and families can't move forward without access to healthcare. That's just common sense. But then the conversation quickly shifts to something much deeper: budget priorities. We hear concerns about cuts to the National Institutes of Health, over 12%. That's not a small adjustment. That's a major shift that could impact research, jobs, and America's leadership in medical innovation. Now here's where things get interesting. When pressed on what should be cut, the response is direct: DEI spending. And look, this is where I'm going to give you a straight, no-nonsense take. From a right-leaning perspective, the argument being made is that taxpayer money should go toward results. Actual cures, actual treatments, actual breakthroughs. The claim is simple. If a program isn't producing measurable outcomes in terms of saving lives or advancing medicine, then it shouldn't be prioritized over critical research. And that's a debate worth having, because at the end of the day, Americans don't care about buzzwords. They care about outcomes. They care about cancer research. They care about treatments that actually work. But here's the problem. When you start seeing reports of cancer research grants being cut, pancreatic cancer, cervical cancer screening, regional health initiatives, that raises serious questions. And instead of giving a clear answer, what we see in this hearing is deflection. The question was simple: who approved these cuts? And instead of a direct answer, we get a pivot to saying budgets are being increased elsewhere. That's the kind of thing that frustrates people, because transparency matters. If you're going to make cuts, own it, explain it, defend it. Don't dance around it. Now let's talk about food assistance, because this part really stood out. We hear that hundreds of people, including children, are losing access to food support, and constituents are literally saying they are hungry. That's serious. And when asked directly whether there's opposition to hunger in America, the answer is yes. But again, it's followed by a shift toward policy messaging about better food. Here's the reality. You can talk about food quality all day long, but if people can't afford food in the first place, that's the real issue. This is where policy has to match reality on the ground. And this is where I think a lot of Americans, left, right, or center, are going to agree. Government programs should be efficient, yes. Waste should be cut, absolutely. But the core responsibility is making sure people don't fall through the cracks. Now, let's move to rural healthcare. This is another major issue. We hear claims of massive investments, billions going into rural healthcare transformation, funding for physician retention, support for community health centers. Sounds great on paper, but then comes the counterpoint. only 1% of funding is actually reaching the community-based programs that are proven to work. And rural health centers are at risk of closing. That's a huge disconnect. And this is the kind of thing that fuels distrust in government. Because you can announce big numbers all day long, but if the impact isn't being felt on the ground, then something is broken in the system. And that's really the theme of this entire hearing. It's not just about numbers. It's about priorities. It's about whether policies are actually helping people or just sounding good in press releases. From a conservative standpoint, there's a legitimate argument for cutting waste, for questioning spending that doesn't deliver results, and for focusing on efficiency. But here's the key. Those cuts have to be smart. Because when you start cutting into areas like cancer research, rural healthcare access, or food support without clear accountability, you risk hurting the very people the system is supposed to serve. And that's where leadership matters. You have to be able to stand in front of the American people and say, here's what we're cutting, here's why, and here's how we're making things better. Not just bigger budgets, not just shifting funds around, real results. Because at the end of the day, this isn't about politics. It's about whether Americans can get health care, whether families can afford food, whether rural communities are left behind, and whether the government is actually delivering on its promises. That's what this hearing exposed. Not just policy differences, but a deeper issue of trust, transparency, and priorities. If you made it this far, make sure you like this video, subscribe to Freedom Forge, and let me know in the comments. Do you think these budget decisions are about efficiency, or are they putting Americans at risk? Because this conversation is far from over.